Hi, this is Ronico. This lecture, we will talk about pharmacological management of pain. Mostly, we will focusing on reviewing available pain medication out there that we commonly use for pain control in dogs and cats. Let's start reviewing some of the clinical pain that we commonly see in our practice. Inflammatory pain is usually responsible for acute injury or post-op pain. This is the type of pain that generally can be reversed as the tissue heals or given an appropriate pain medication such as NSAID. If this type of pain can persist, it can develop into chronic pain. Visceral pain is a type of pain from the activations of nociceptors of the visceral organs, for example, inflammations due to pancreatitis. Acute pain, also known as adaptive pain or nociceptive pain, that occurs when a strong noxious stimulus, for example, mechanical, thermal, or chemical stimulus, that impacts the skin or deep tissue that causing pain. Acute pain actually provides some protective to the body because it allows the body to protect against potentially severe tissue injury. As opposed to chronic pain or maladaptive pain, this is the type of pain that lasts a long time without noxious stimulus, and it does not serve as a protection to the body. It can result in peripheral nerve or central nervous system sensitizations. There's a various form of chronic pain or maladaptive pain, such as cancer pain, neuropathic pain, or like chronic visceral pain, etc. Specifically, neuropathic pain is the one of the pain that we commonly deal with in our general practice. This is the type of pain that caused or initiated by a primary lesion, injury, or dysfunctions in the peripheral nervous system or central nervous system. We call it sensitizations. And a lot of medications out there, not only to target the inflammation, but also try to target the neuropathic pain or other form of chronic maladaptive pain. So the main reason why we need to manage pain or get the pain under control is because there's a lot of negative consequences of pain if it is not being under control. For one thing, you're going to have increased inflammatory mediators that causing not just the local area it's inflamed or swollen, but it could be the systemic problem. It can cause tachycardia because it's painful, decreased GI motility, possibly may cause constipations, delay healing, reduced immune responsiveness, causing a lot of stress and depressions. And also because of pain, the patient may not be able to sleep well, and because they're not sleeping well, the body is not healing properly. So that is what we call the vicious cycle. When it comes to treating pain, especially maladaptive pain or chronic pain, we know that we should use a multimodal analgesia protocol for a couple of reasons. One is different kind of medication, when you combine together, it will provide a synergism that provide a better pain relief. Different medication targets multiple sites within the pain pathway, so you might be able to get a better pain control. As we know, in the chronic pains, there's a lot of mediators that involve, there's a lot of pain pathway that involve, so only using one medication is probably not going to give you the best results. Using different kind of medication combinations, it also could help us to lower down the dosing potentially, and that would help to minimize the side effects and also have a better successful case outcomes and limit further damage for the patient or for the lesions. Pain drugs that today we're going to talk about include NSAID, opioids, and some of the pain-modifying analgesics, such as epileptic drug, which is the gabapentin, NMDA antagonist, which is amantadine, tricyclic antidepressants, or TCA, which is the amitriptyline that we're going to talk about. The rest of them, alpha-2 agonists, local anesthetic, those we're going to talk about in session 4. Let's begin with non-steroidal anti-inflammatory drugs, or NSAID. The mode of action of NSAID include inhibiting COX-1 and COX-2 receptors, and it is metabolized in liver. This figure showing you when tissue is injured, there's activation of arachidonic acids, which further activating two pathways. One is the COX pathway and the other one is the LOX pathway. NSAID specifically would block the COX pathway, which further inhibiting prostaglandin and thromboxane. The benefit of NSAID include antipyretic, anti-inflammatory, and analgesic effect. Most of the NSAID that we use in pets, it's being proven for pain control, and they're not controlled drugs. The other benefit of NSAID is they don't cause sedations or have any cardiovascular or respiratory effect, although they do have effect on GI mucosa, kidney, and liver. And here just a list of NSAID that have been approved to be used in dogs and cats in the United States. Aspirin is not being approved in dogs and cats, none of them. We have Caprofen, Decoxib, Etodolac, Ketoprofen, Firocoxib, Merclofenanic acid, meloxicams, phenylbutazone, robenacoxib, tipoxylin, and also tofenamic acid. And here showing you what can be used in dogs and which one can be used in cats. The side effect of NSAID and caution include it could possibly cause GI ulcerations and upset. It may have renal toxicity, especially that using it for long term. It also have hepatic toxicity. It also inhibits platelet aggregations. If you're worried about that NSAID would cause any serious side effect on the pet, so here's some of the suggestion that for you. Make sure that you get an accurate or lean body weight. So if I want to dose NSAID for a 8 out of 9 BCS of the patients, I might probably looking into give it 6 out of 9 because you don't want to calculate fat into the dosings for NSAID. Of course, you need to have an accurate owner history. Most commonly, I will ask the owner, does the dog have ever taken NSAID or before, and does the dog have any side effects? If the owner tell you that, yeah, the dog very sensitive to NSAID, have a history of GI ulceration before with NSAID, then that would be something I would looking for a alternative medications instead of just giving out NSAID for the patient. And always give NSAID after food or wet food, dry food, it really doesn't matter. But ideally is that we need to give with food or after food. And of course, we all know that when giving NSAID, you need to avoid giving steroid at the same time. NSAID may also have some impact on tissue healing. Some studies have found that it may impede the inflammatory phase of healing process that delay overall healing time. This figure showing you in acute fractures of the femur, the body will initiate inflammations, which include release of different kind of cytokines, and those cytokines is the one that helping to speed up the healing process. But if the patient is getting a long-term or a period of time of NSAID, it might suppressing this inflammatory phase that further delay the healing time. As a matter of fact, in humans, giving NSAID beyond the first 24 to 48 hours have recently fallen out of favor, mostly because there's increasing evidence show that NSAID may delay the tissue healing, and of course it carries a risk of adverse reactions. And here are the two studies that I found using long-term Caprofen on bone healing in dogs. First study published in 2011 concluded that long-term administration of Caprofen appears to inhibit bone healing in dogs underwent tibia osteotomy. The second recent study published in 2009 concluded that long-term administrations of Caprofen had a negative effect on bone healing, and NSAID should be used cautiously in dogs at risk for delayed bone healing. So whenever you have a patient that dealing with delayed bone healing and the patient is getting an NSAID, you might need to consider switching the NSAID to a different medication for pain control. And here's just the list of the NSAID and its dosing used in dogs and cats. What about NSAID in cats with chronic kidney disease? Meloxicam and robenacoxib or Ansiol are the two NSAID can be used in cats to manage pain. For kidney failure, as long as the cat is with a stable, well-managed stage 1 or stage 2 kidney failure, it is okay to use either meloxicam or robenacoxib to manage osteoarthritic pain. But we generally recommend do a titration to the lowest effective dose. For cats that with progressive azotemia or weight loss or progressive stage 3 or 4 chronic kidney disease, we do generally recommend avoid using any NSAID on those patients. Owner education of potential breeds is very important. Owner need to continuously monitor to make sure the pet does not have decreased food or water intake or have increased water loss through vomiting, diarrhea, or polyuria. Before starting NSAID or during the NSAID treatment, we also need to manage some of the comorbidities such as dehydrations, proteinuria, hypertension, and hyperphosphatemia. But overall, even though NSAID may be helpful, but we still need to consider other non-pharmaceutical therapies such as laser acupuncture, physical therapy that may able to better control the pain rather than just rely on NSAID for pain control when the patient have a severe osteoarthritic pain. Gabapentin or galoperin is the new class of NSAIDs. It is a prostaglandin EP4 receptors antagonist NSAID. It is also a piperine class of drugs that does not block COX receptors. The general mode of action of galoperin is it targets EP4 receptors within the COX pathway, which is actually further down the COX pathway. It decreases the inflammatory effect of the prostaglandin, and that's how it helps for inflammations and also pain. Because of its anti-inflammatory and analgesic effect, it promises for mild to moderate osteoarthritic pain without causing any adverse effect that associated with NSAIDs. Dosing-wise, we usually give 2 mg per kg orally once a day, with or without food. In general, I do give it with food because one of the common side effects of galoperin is causing vomiting or sometimes diarrhea. So giving with food actually may help to prevent that kind of side effects. So this is the COX pathway. Again, we have a activation of the arachidonic acid. Then we're going to have the COX-1 and COX-2 receptors, where the COX-2 inhibitors NSAID, that's where it blocked the whole pathway. For the galoperin, it blocked further down the COX pathway, which is the EP4. EP4 have found that it will be upregulated during arthritic states. So if the patient have arthritic pain, you're expecting there's a lot of overexpressions of EP4 receptors. And galoperin is the one that target these receptors that help for reducing inflammation and pain. Because it does not block COX-2 entirely, and that's why it bears some of the adverse effects of COX-2, such as GI ulcerations, hepatotoxicity, and nephrotoxicity. And that's one of the main reasons why galoperin has become very popular, just because it does not have that kind of side effects. However, common side effects of galoperin include GI effects, vomiting, loose stool, mucoid, watery, or even bloody stools. But we usually don't worry that the GI effect or side effect is caused by GI ulcerations. Most likely, what the company explained is that it could be because the irritations of the drugs on the GI mucosa. If it is true, then this patient might need to take Galliprant with food so that it helps to prevent irritations and thus the side effects. Company also have claimed that dogs that less than 9 months of age or weigh less than 8 pounds should not take Galliprant because they have not tested the safety on those patients yet. It should also avoid concurrent use with NSAIDs or steroids, not because it is not safe, but the company claimed that they don't have enough evidence or study to prove combining both may provide you better results or it does not cause any side effects. So at this time, we do avoid using Galliprant with other NSAIDs or Galliprant with steroids. There's two warnings that give out by one is by the US FDA and the other one is actually on the UK label of the Galliprant. So US FDA have put out a statement saying that because all NSAIDs interfere with the other positive function of prostaglandins, they can cause side effects, some of which are serious, and Galliprant is no exception. On the UK label, it says use with cautions in dogs suffering from pre-existing liver, cardiovascular, or renal dysfunctions or from GI diseases. So at this time, it seems like Galliprant is safer than NSAID, but it may not be completely safe. So before you use it or when you are using it, you see some side effects, you might need to dig further to see if it is caused by Galliprant. And even sometimes for older dogs, I would do blood work first before I give Galliprant so that I have a baseline. And then if anything happened, you can always redo the blood work to compare if there's something have changed after giving Galliprant. This is just a table showing you how to dose the Galliprant, and you can actually find it on the company website. And this is the table I get it from Plums. Next, let's talk about opioids, which is the cornerstones of effective pain management. There are so many opioids out there on the market, and they are vary in receptors, specificity, potency, and efficacies. In general, when it comes to chronic pains, such as neuropathic pains, opioid is used as a multimodal regimen, not as a standalone analgesic. The general mode of action of opioids is binding to opioid receptors such as mu, kappa, sigma receptors, and also their subtypes. Opioids can be divided into 4 groups: full agonists such as morphine, methadone, fentanyl, meperidine; agonist antagonists such as butorphanol, nalbuphine; partial agonists, which is buprenorphine; and antagonists, naloxone, namorphine, and naltrexone. There's a synergistic effect when combined with NSAID and local anesthetic. That's why, in general, we try to combine opioids with other pain medications. And by doing so, you might also be able to reduce the dose of opioids. However, mixing opioids together can result in an unpredictable effects. So we'd rather mix with NSAID or other analgesics rather than mixing 2 opioids together, because by doing so, you might causing even more side effects, such as respiratory depressions, bradycardia, sedation, dysphoria, excitement in cats, especially when you're using a low dose, vomiting, nausea, which could decrease appetite, and IV bolus of opioids have found that it may cause a severe histamine release, which not common in the rehab service, because we usually don't give IV bolus of opioids for our patients. We usually give either IM, sub-Q, or oral route. Most of the opioids have a very poor oral bioavailability. This is why we generally recommend IV or IM administrations. Buprenorphine can be used as a buccal route or transmucosal routes. Especially in cats, have found that it has some pain relief effect. The antagonist of opioids is naloxone. So let's talk about each of the opioids briefly. Let's start with buprenorphine. It is 25 to 50 times more potent than morphine. When you're giving eye injections, it does have a delayed onset of actions, about 40 minutes. Once the effect kicks in, the analgesic effect may persist for 12 hours, but usually is between 6 to 8 hours. And here is the dosing for dogs and cats that you can give IM, IV, sub-Q, or oral transmucosa. For dogs, you give every 6 to 12 hours. For cats, you give every 8 hours. Although the new medication Symbadol has claimed that you can give once a day. Buccal or oral transmucosa route is well tolerated and can be effective, especially in cats. Maybe in dogs as well, because when you give buccal administrations of buprenorphine in dogs, the bioavailability can be up to 50%. Methadone is another common opioid that we use in practice. It is 1 to 1.5 times as potent as morphine. The other reason why some rehab therapists like to use methadone because it also inhibits NMDA receptors, which would benefit patients, especially if you're treating chronic pains or neuropathic pain. It has a short-term analgesia, 4 to 6 hours, and it may cause sedations. Panting, vomiting, vocalization, cardiorespiratory depressions are the common side effects of methadone. When compared to morphines, methadone does cause less sedations or vomiting. The dosing for dogs, it's 0.1 to 0.3 mg per kg IM, sub-Q, IV every 4 to 8 hours. Greyhound, they may require a higher dose than other breeds, which you probably know that Greyhounds is kind of special when it comes to anesthesia and pain management because they may not respond well to the normal dose of the analgesia or anesthetics. So we need to always keep in mind that this is a breed that we always need to make sure we are adjusting the dose if needed. Fentanyl transdermal patch is another opioid that I commonly use in my practice, especially for uncontrolled chronic pains or cancer pains. For example, osteosarcoma. Fentanyl is a ultra short acting and it's about 100 times more potent than morphine. The way that this patch works is the fentanyl will slowly absorb through the skin to reach therapeutic level. In dogs, it may take up to 24 hours to see the analgesic effect. In cats, it'll be shorter. It's between 4 to 12 hours. But usually, after 6 hours, you should be able to see some analgesic effect in cats. So once the effect kicks in, the patch can provide analgesia for at least 72 hours. From the Plum's book, it said usually 104 hours, but 72 hours is the one that we usually would tell the owner. If you want to continuously using the patch, you have to change the patch every 48 hours. Okay. The common side effects of fentanyl include dose-related respiratory and CNS suppressions, and also bradycardia. You might see some rashes at the patch sites. Also depends on what kind of like glue or what kind of bandage you're using too. You might see urine retentions, constipations, dysphoria, or agitations. You have to be extreme cautious when you are using fentanyl patch on geriatric, ill, or debilitated patients. Okay. The patches come in a different size. Then in order to find the right size, I usually refer to the Plum's book. And this is just a table that I got from the Plum's book. So it's for you to look at. Based on patient's body weight, then you select like how big the size that should be. When you put the patch on the skin, I usually choose skin between the scapula. That's the area that dogs usually not able to turn around and chew it or swallow it or bite it. Some veterinarian would put it lumbosacral regions. Some other region that you can consider is lateral thorax, inguinal area, and even base of the tail. But you just have to be very careful that those patient doesn't turn around and chew it off and swallow that patch. Tramadol is a weak opioid agonist with the mode of actions of mu receptor agonism through M1 metabolite. So when tramadol is ingested, the liver would convert it into M1 metabolites. That's the M1 metabolite that act on the mu receptors. Tramadol also inhibits norepinephrine and serotonin reuptake, and because of that, it will cause significant sedations due to the increased level of serotonin within the body. In general, tramadol is useful as an analgesic in cats, not so much in dogs, especially when treating osteoarthritic pain. There's at least 2 studies have found that adding tramadol on top of NSAID does not provide additional analgesia for dogs with arthritis. Given that reason, a lot of veterinarians no longer prescribe tramadol for treating arthritis. Tramadol also very useful for adjunct for post-op or chronic pain sometimes. When it used to treat chronic pains, it may take up to 2 weeks for a full analgesia benefit. And tramadol is a control drug currently. The oral bioavailability of tramadol is about 65% in dogs. Some studies show even lower than 30%. An M1 metabolite has a half-life about 2 hours after oral route, even shorter in greyhounds, which is about 1.1 hour. Because of that, when you want to give tramadol, you need to give at least every 8 hours. Otherwise, it may not provide the most benefit when it comes to controlling pain. Some veterinarians even would recommend every 6 hours when taking tramadol. For cats, the bioavailability is about 60% and the half-life is about 4.5 hours. So in cats, it is okay to give every 12 hours, or some veterinarians even think that tramadol in cats can last for 24 hours. They would just ask the client to give once a day. Generally, you can try once a day first in cats to see how it works. If that doesn't work, you can always go twice daily. Side effects of tramadol include excessive sedations and GI signs. For example, constipations, vomiting, diarrhea, and loss of appetite. Occasionally, you might see some behavioral changes, such as neediness or whining. Because there's a report showing that tramadol may trigger seizures in certain patients, you might need to avoid using tramadol if the patient have a history of seizures or patient have epilepsy. We also need to avoid using tramadol concurrently with antidepressant because, again, tramadol increased the plasma level of serotonin. So if you're giving antidepressant, you're gonna increase that serotonin level even more. That could lead to serotonin syndrome. Patients that have impaired renal and hepatic functions may need to adjust the dose of tramadol. Long-term efficacy of tramadol may decrease with time, so ideally we only want to use tramadol for a short period of time, just like other opioids. You don't want to use it for too long. The longer you use, the less efficacy that you're going to see. This medication is very bitter, so I generally tell the owner that give tramadol the last pill and don't mix with other pill, because if you mixed with NSAIDs, other supplements, medication together, I could guarantee you that the dog would not take any of the medications. I would tell the owner to give the medication first and leave tramadol the last, because tramadol is very bitter. A lot of dogs, they don't like it at all, especially in cats. The next class of medications is gabapentin, which is an anti-epileptic drug. The mode of action of gabapentin include it is a GABA analog, but it does not increase GABA level in the body. What makes it helpful pain control is it blocked voltage-dependent sodium and calcium channels, which help to inhibit excitatory neurotransmitters within that pain transmissions. That's how it helped to suppress the pain transmission within the body. In general, it's used as an adjunct therapy for chronic pain, especially for neuropathic pain. And that's why we commonly use gabapentin for nerve pain. Gabapentin have found to be superior to morphines and amitriptylines for allodynia. The side effects of gabapentins include you would see transient sedations, ataxia, and behavioral changes. So those are one thing that I would warn the owner when given the gabapentins. The dog gonna be sedated and also may have ataxia. Especially the big dog, owners are very worried about that. After taking medication, the dog have more trouble getting up, or even have not able to get up and walking. So those are the signs that, or side effects, I would warn the owner so that they understand. The side effect is usually transient. The longer the patient take it, the less side effect they're gonna see. So the first week would be the time that the owner would see a significant side effect from it. In humans, gabapentin have found may have withdrawal syndromes after abrupt discontinuations. We don't think dogs would experience the same way that humans do, but if the owner complains about after stopping the gabapentin, the dog seems like very agitated or have some like weird or odd clinical signs, then you might consider this is a withdrawal syndrome and might put the dog back on gabapentin and start slowly wean off the gabapentin. The elimination half-life of gabapentin is about 2 to 4 hours. And dosing-wise, dogs, we usually start with 10 mg per kg every 8 to 12 hours. If you're worried about sedations, then you can start with every 12 hours for first week. And then the second week, once the side effect gets better, then you can always increase to every 3 times a day. For cats, the dosing is 5 to 10 mg per kg every 8 to 12 hours. If you don't see any benefits after giving the normal dose range, then you can always increase if needed. In dogs, you can increase up to 30 mg per kg. And some veterinarians even have tried increase to 50 mg per kg in order to see some analgesic effect. But I would not go straight to a high dose. I would start with low dose, and you might increase 5 mg per kg, every 2 weeks, every 4 weeks, until you see the optimal result. Some animals may need several weeks to months for resolution of pains, or sometimes even longer. In general, if I want to give gabapentin, I would give at least a month and then reevaluate. If the patient seems working well with the gabapentin, I would continue that. Or if I think the nerve pain is under control, then I might slowly stop it and to see how the dog is doing. Gabapentin is eliminated through the renal route. So when patients have decreased renal functions, we do need to kind of adjust and lower down the dose of gabapentin. In humans, oral medications may contain xylitol. So that's one thing when you want to prescribe gabapentin through the human pharmacy, and make sure that they don't give out the oral solutions gabapentins. Most of the oral solutions from pharmacy, they may contain xylitol. So if I want to give any kind of medication, I will make sure that it's not in the liquid form. If gabapentin causes a lot of side effects, you can consider a alternative drug, which is the pregabalin. It is 3 to 10 times more potent than gabapentin. The dosing is lower, and it causes less side effects compared to gabapentin. The only downside is it is much expensive than gabapentin. But it may worth to try, especially for big dog that you think that gabapentin would cause a significant sedation and ataxia that would worry the owner. Then you might consider using pregabalin that may have less side effects. Amantadine is another class of medications for pains, especially for chronic pains. It antagonizes NMDA receptors in the nervous systems. It also increased dopamine in the central nervous system as well. By increasing the dopamine, it can help to control the trembling, shaking, and this is why amantadine in human they use that for Parkinson's disease, just because of the dopamine level help to control the trembling. So back to NMDA. So when the body has chronic pain or central sensitizations, usually that we have a overexpress of NMDA receptors in the nervous system. So amantadine is the one that helps to suppress the NMDA that provides some pain relief. In general, we don't use that as a alone treatment. We use that as a adjunct therapy, combining with NSAID, gabapentin, and opioid, so that we can control that chronic pain better. By combining the medication, especially for opioids, it found that it may able to decrease the tolerance of the medications. For the dosings, dogs and cats, you can give 3 to 5 mg per kg every 12 to 24 hours. Originally, we think that amantadine can be given only once a day, but recently, when you look at the Plum's book, they recommend that giving twice a day or every 12 hours may provide you a better result. So you can start with once a day and wait for maybe 1 to 2 weeks to see if there's any beneficial. If not, you can always up to like twice daily. Common side effects of amantadine include agitation, loose stool, flatulence, or diarrhea, dry mouth, dizziness, and confusions. Amantadine may require 5 to 7 days or sometimes even longer to have a positive effect. And do not use with other medication that could increase dopamine concentration, just because amantadine also increases dopamine level within the body. Amantadine is eliminated through renal routes, so just like gabapentin. So if the patient have chronic renal failure or decreased kidney function, you might need to adjust the dose of amantadine. Amantadine, when giving a very high dose, it also have embryotoxic and teratogenic effect. So in general, we usually not worry about that because most of the patient is either neutered or spayed. But just so you know that that's a major side effect of amantadine. The next class of analgesic is the tricyclic antidepressants, specifically amitriptyline. The mode of actions of TCA is it inhibits norepinephrine and serotonin reuptake. There's some study have found that amitriptyline potentially antagonizes NMDA, inhibits sodium channel, and microglia cells activations. So those are the important actions when it comes to control chronic pains, especially for neuropathic pain. It is used as an adjunct analgesic on top of other medications. Dosing wise, you can give 1 to 2 mg per kg every 12 to 24 hours. If that doesn't work, you can always increase up to 3 to 4 mg per kg. In cats, we usually only give 2.5 to 12.5 mg per cat once a day. per plums, if you want to discontinue amitriptyline, you have to taper it slowly over 2 to 3 weeks in order to prevent the withdrawal syndrome. Side effects of amitriptyline include antihistamine effect, which cause some sedations for the patient. It also have anti-muscarinic effect, which causing dry mouth and increased heart rate. It also may reduce the total T3, total T4, and free T4 level within the body. So if you're giving amitriptyline for a older dog or geriatric dog, ideally you want to do a blood work looking at the T4 and T3 before you're giving it. And then they monitor them if the patient is on the long term of amitriptyline. Okay. High dose of amitriptyline can produce life-threatening cardiotoxicity. In cats, amitriptyline may reduce grooming, weight gain, and sedations, which are possible. Amitriptyline may interact with a lot of drugs. So before you give amitriptyline, I would recommend that look at the PLUMS book and to see what medication that need to be aware. For one thing, because amitriptyline increase serotonin, so you definitely don't want to give with other antidepressants, or you don't want to give it tramadol, because tramadol, as we mentioned earlier, it could increase serotonin in the body. So amitriptyline and tramadol, when you combine both medications, you have to be very careful, not causing serotonin syndrome. Okay. Again, do not use with other behavioral modification drug, just because that, again, it may increase the concentration of serotonin in the body. And also do not use with monoamine oxidase inhibitors for the same purpose, for the same reason. Other pain-modifying analgesic drugs include meropenem and biphosphonate. Meropenem is a NK1 antagonist. They have found it would benefit patients for post-op pain or even chronic pain. The downside about meropenem is it's very expensive, either injections or oral medications. So it may be beneficial for use for short term, but usually that owner would not want it for a long term just because of the expense. Biphosphonate is commonly used for osteosarcoma because it reduces osteoclastic bone resorption. Some studies have found it may benefit patients with a severe osteoarthritis where they have a lot of bone formations within the joint. The two medications that we commonly use in pets is pamidronate and zoledronate. Biphosphonate only given IV, so it's not given orally because the bioavailability is very, very low. And then when you give the IV infusion, it has to infuse for a certain amount of time. For pamidronate, require longer infusions compared to zoledronate. Again, this is going to add up the cost of the treatment as well. This is why one of the reasons we don't commonly use that for treating osteoarthritis. In summary, as we all know, pain management requires multimodal approach. And one of it is pain medications. Whenever a patient has pain, we need to start the treatment as soon as possible, no matter what you want to use, medications, physical therapy, or modality. When it comes to pain medications, especially treating chronic pain, and here's my general approach. If the patient can tolerate NSAID, I would consider NSAID. I may add gabapentin or amantadine. Recent years, I kind of prefer amantadine because I personally see a better result when combining NSAID with amantadine. And amantadine usually doesn't cause a lot of sedations compared with gabapentins. But if the patient show more nerve pain or have more nerve pain component, then I might consider gabapentin over amantadine because gabapentin's meant to treat nerve pain. For various chronic and control pain, sometimes I would combine all three together: NSAID, gabapentin, and amantadine. I would use tramadol or opioids occasionally for a wind-up pain. Let's say if the patients have been doing well for a while and so suddenly the doctor just have acutely painful, you think there's a wind-up pain, then I would give a short term of tramadol. If it is very severe, then I might consider giving injections of opioids or fentanyl patch, just so that I can get the wind-up pain under control as quick as possible. If the patient have some behavioral issues, sleeping issues, I might consider giving amitriptyline because I use it because it also sedate the patient, so the patient can be a little bit quiet and also able to sleep better as well. Okay. And gabapentin, amantadine, amitriptyline, they could possibly cause sedations. So you have and tramadol as well. So you have to be careful when you're combining all those medications together. As we mentioned earlier, tramadol and amitriptyline, they both increase serotonin. So combining both medications, definitely have to monitor for serotonin syndrome. Okay. And also keep in mind that even though this lecture would talk a lot about pain medication, how to combine them, but this is not the only answer when it comes to treating chronic pain. You still need to consider other modality, acupuncture, laser, and physical therapy. And that's how we kind of utilize multimodal, multidisciplined approach to target the pain as much as possible. That's the end of the lecture. Thank you so much. If you have any questions, feel free to email me. Thank you. Bye-bye.